Congratulations on picking pediatric orthopedics for your fellowship, and thank you for considering Johns Hopkins as your destination for one of the most formative years of your orthopedic career. At Hopkins, we have a very diverse, single fellow-focused fellowship that has both a blend of autonomy and mentorship. So why Hopkins? As a single pediatric orthopedic fellow, you'll truly be able to tailor your experience. We offer exposure to all subspecialties: complex spine, pediatric sports medicine, hip and pelvis pathology, limb deformity, neuromuscular care, and other subspecialties.
At Johns Hopkins, we have a rich and successful history of training fellows, having had over 25 excellent fellows since 1990, and they have gone into an even mix of academic and non-academic careers. We benefit from being connected to the Kennedy Krieger Institute, which has excellence in neuromuscular disorders with spina bifida, cerebral palsy, SMA, and many other conditions. And then we also have the McKusick-Nathans Genetic Institute, the first medical genetics department in the world.
At Hopkins, we have diverse specialists involved in multiple areas of the body in terms of surgery. We do scoliosis surgery, neuromuscular pediatric orthopedic, sports, and limb deformity and limb lengthening. I'd love to have my fellow work on one side of the limb while I do the other. So we have a huge volume of cases and the fellows get to pick what they want to do. I think the learning opportunities are tremendous. In addition to that, covering trauma gives our fellows the exposure to trauma surgery.
Our spine program corrects over 150 patients per year, including idiopathic, neuromuscular, syndromic, and other miscellaneous disorders. We perform all types of procedures, including growing spine procedures, metacasting, vertebral tethers, posterior fusions, and vertebral column resections. The fellow can be as much or as little involved in the spine program as they wish for their future career goals.
I think one of the best things about Johns Hopkins is the patient population. As you'd expect, we have a very urban population at the downtown offices, but around the peripheral sites and even at the downtown office, we do see a wide variety of different patients, including international patients. I think Johns Hopkins University kind of comes with its own referral base. It's a very well-known university system. I think one of the most impressive things is the amount of complex patients we're seeing on a day-to-day basis. I would consider Johns Hopkins more of a quaternary referral center.
Our fellowship program is also truly comprehensive in the sense that the Children's Hospital is connected to the adult Johns Hopkins Hospital, and so you'll be able to see, if necessary, the full spectrum of pediatric orthopedic pathology from a young age into adulthood. One afternoon you could be operating on a middle-aged adult, whereas in the morning you were taking care of a pediatric patient, both with the same pathology but just at different stages.
There are several conferences and learning experiences throughout the week. On Mondays, there are attending-led lectures, and on Wednesday, there are resident-led lectures that cover all topics within pediatric orthopedics. On Tuesdays, we often examine a patient who is having surgery that day and who has interesting physical examination findings. On Friday, we have our pre- and post-operative conference. All cases are presented by the residents, and we discuss indications and specifics of each case. Often, attendings will bring up interesting or complex cases to get feedback from the other attendings. Throughout the year, the fellow also has one-on-one learning sessions with each attending designed to delve deeper within one area of pediatric orthopedics.
So why Hopkins? We encourage you to come and find out for yourself. Thank you.